The low wages paid to medical workers has led to apathy, which in turn has affected the delivery of health services to communities. However, President Museveni says as a result of a small resource envelope, the health ministry should devise other income-generating means to improve the welfare of health workers. Almost every year, medical workers across the country stage industrial action which puts the lives of patients in harm's way. The president believes that their meager income can be supplemented by setting up business ventures.
Please sit down and look for other things. There can be other things like shops for the health workers, dedicated, where they can buy things cheaply. Buy on in the army we call it army shop.
In 2016, the World Health Organization set out key objectives of improving health standards, and amongst them is the provision of better medical services for a healthy population. However, the president disagrees with that view.
What if we don't have money? Does it mean that we shall have no medical service because we don't have money? Does it mean that we shall not have an army to defend us because we don't have money? We say rubbish.
Members of the Uganda Medical Association narrated to him the challenges they face while on duty, including low wages and poor housing.
Most of the senior house officers pay for themselves, and on top of that, they are not remunerated, and yet they have dependents.
We still have a number of training centers that are not able to accommodate interns and that are not able to provide feeding for interns, yet these interns are required to work in the health facilities for long hours, and we still continue to have delays of their salaries and their allowances.
Senior house officers pay for themselves. Why? Why do they pay for themselves when they are working for the government?
President Museveni promised to grant the Medical Association 5 billion shillings in their savings coffers.
In the next financial year, because now we have already gone into this financial year, I don't want to kutomera. Kutomera is to bump into things. But in the financial year of 2017-2018, I will put 5 billion shillings in that.
With pent-up frustration, many specialized doctors and nurses have left the country to earn better salaries abroad. The consequences in Uganda are clear. The doctor-to-patient ratio in 2013 was estimated at 1 to 24,725, with a nurse-to-patient ratio of 1 to 11,000. The World Health Organization recommends 1 physician per 1,000 people.